What's up, everybody? It's Dr. David here. I am at the gym. I'm already halfway into my workout, as you can tell, and just trying to get us set up on Instagram. Yeah, we're good. Okay. Welcome to the gym with me. Be answering some questions. Already got comments in here from YouTube. See one or two from Facebook. We're on Facebook, YouTube, and Instagram as well. Can you guys just let me know you can hear me? I've got the mic right here. It's a little noisier today than usual, but just type in the comment in the chat that you can hear me. Just say I can hear you. Who's here? I see Heinrich, Fritz, Tom Jacobs. Nina says, yep, great. Joanna says, I hear you. Fantastic. I'm glad y'all hear me. Great. Kathy's there. Sophie says, yep. Fantastic. Thank you guys for letting me know that I'm hearable. Joan is also letting me know. Look at that nice Labrador. Nancy says, hi from Canada. Hi, Nancy. Fantastic. Dawn says, yes. All right, guys, we're going to be answering questions. Let's get to it. I got to be quick today. I got to be out of here in like 35, 40 minutes. So let's get into it. Let's get right to it. First comment I have on here, 20-year-old male, Heinrich Fritz says, I tore my ACL 5 weeks ago. I bought your ACL recovery course, and I'm curious to what the walking criteria is, if it means with crutches or not for phase 1 and 2. I still can't walk yet. When it comes to walking, when you have an ACL tear, you should not be walking if it hurts. You need to get on crutches if it hurts. Basically, you need to be on crutches until it no longer hurts to walk without crutches. Gradually, as you keep walking with crutches, you should find that you need to put less pressure through the crutches, and you can tolerate putting more pressure through your leg without your knee hurting. That's how you kind of wean your way off the crutches. Then there'll come a point where you can walk part of the day without crutches, and then you got to get back on the crutches, and then you can start to walk most of the day without crutches, but then you might need them at the end of the day, and then there'll be days where you don't need the crutches. So use the crutches a lot right now. Make sure you're in a brace as well with that ACL. It will heal as long as you don't overstress it, and being in the crutches and using the brace will help out tremendously, Heinrich. Good question. Tom Jacobs says, is red light therapy help on a painful knee? We don't know. We have no idea. Let me get to my next set here. I'm actually on calf raises. Is this a good spot? All right. So there's research being done. It's mixed right now. We don't have any like super solid research about red light therapy being helpful for pain. Some people say that it's helpful. Other people say that it's not. No difference. What I would say is give it a shot. See if it works. See if you feel like it helps you. It might, but it's not fixing the root problem. You still have to find out what's causing your knee pain. Is it an arthritis problem? Is it a meniscus problem? An ACL problem? Should you be in a brace like I was talking about for Heinrich? Should you be offloading like Heinrich might need to do, or other people with like a meniscus problem or an arthritis problem? Those are probably going to be more impactful things to pursue than red light therapy, but might help with the pain. I would use this as a substitute for pain medication if you're looking at red light therapy, but not as a way to solve a knee problem, like to fix it for good. Mrs. NL Willie, since torn meniscus 2 years ago, unable to straighten the knee fully, painful after too much activity every day, tried PT, strengthening the glutes, stem cells, chiropractic care, no help. Next up, surgery, question mark. For a meniscus problem, have you tried ARP stuff? Because it's different than typical physical therapy. It's definitely not surgery. Glute strengthening is, I would just question if you're doing that right, because sometimes people miss strengthening the glutes. Like if you felt it working in your glutes, then that's the best indicator. But the glutes aren't the whole thing. Like you might need to work on your foot muscles. You might need to work on your abdominal muscles. But if you do all that stuff, and you're not making much progress, then yeah, potentially surgery is the issue here. Especially if you have a permanent loss of motion. If you're expecting to straighten out your knee, and it's already been a couple of years, it might be time for a surgery. Not everyone with a meniscus tear gets a locked out knee like that. That happens occasionally, and when that happens, it's usually like a chunk of the meniscus that's obstructing. It could be too that there's like scar tissue that's not allowing it to move in the right spot. An alignment problem in the knee could be an issue as well. There's many factors, but I have had some patients over the years that we work on everything, they're doing it right, and then their knee just doesn't fully straighten. And that's the harder one, because you can miss some bending. You could bend quite a bit, but straightening out, you need to be able to do that to walk and do most things. So that could be a surgery situation if you can't tolerate it, if you can't live with it. I've had some people just live with it. They say, I get around okay, I'm just not gonna be running anymore. But you got to figure out what works for you, Mrs. N.L. Willie. Sue Mary, my piriformis is catching on my sciatica nerve. What exercises can I do? Taking into account I'm 71 with dodgy hips. This is a good one. Let me get some exercises in as I do this. The piriformis, that poor muscle, gets blamed for so much, and it's not always just that. There's tons of muscles back there along with the piriformis. There are many deep hip rotator muscles, of which the piriformis is one. It's just closest to the sciatic nerve, and even though it hurts right in the glutes, that's usually why people will say that they have piriformis problems, because they feel it in the glute, and that's where the nerve is. And then maybe they have sciatic symptoms going down the leg too. It could actually be the pelvis is shifted. So if your pelvis bones right here can be shifted this way, it could be a muscle imbalance. It likely is a muscle imbalance. There's more to it than just the piriformis. So I'm hanging on the piriformis because I feel like that's an old diagnosis. It's outdated. People still think about it and try to treat it like medical professionals. And I have successfully helped lots and lots and lots of people with sciatica and never once focused on the piriformis. It's not really it's an old diagnosis. It's an antiquated situation. We need to look deeper than that. As far as exercises, you need to work on your abs, your lower abs especially. Like, in fact, I'm going there next. Let me just walk you through that. If you think about your abs, when you lie down on your back, doing sit-ups like this would be like the end goal. But at the very beginning, you might just need to be pushing your back down flat, just like that, which makes your glutes want to work. And when you push your back down flat, you need to be activating your lower abdominals. So lower abdominals are below the belly button. Belly button's right here for me. Pubic bones right here. That space in between, those are your lower abdominals versus upper abdominals up here. A lot of people, when they work out their abs, they're working out their upper abdominals. But if you just flatten out your back as you come up, you can target your lower abdominals a lot better. And you don't need to come up all the way like I am. Like I can go all the way to my feet and work on this, obviously. But if you're starting out, just holding your back down flat is a good starting point. If you're going to start to do the motion like I am, just coming up partially like to your thighs is enough. Eventually work your way to your knees, eventually to your shins, eventually ankles, and then feet. You just work your way gradually up. It could take you weeks, months even. That's normal. But getting good ab strength will help to set your pelvis correctly. And then pairing that with glute strength, because the abs attach to the top rim of the pelvic bones, and then the glutes attach to the outside back part of the pelvic bones. And so if you have sciatica, you'll decompress your spine. You'll put the right forces through your spine, which is where the sciatic nerve starts, because the nerves that come out of the spine. By getting your ab strength, you'll put good space. You put good forces through your spine, which puts good space through the openings for the nerves. And then it sets your pelvis straight so that you don't have a shifted pelvis. And then that working with the glute helps to maintain the pelvis stability so that you keep everything happy in the piriformis area and the sciatic nerve area. So hope that helps, Sue. Do we have any super chats here? Guys, I forgot to mention, if you want to jump your comment to the top, if you're on YouTube, you could do a super chat and I'll get to it as soon as I'm done with the one I'm currently on. Who's next here? Joan is next. Joan says, what does it mean when my hip and knee feels like it's giving way? I suspect I have arthritis in both, and both are very weak. Yeah, it means that there's something wrong with the joint when it gives way. And when people say it gives way, for those of you that don't know, what they're usually talking about is you're going to be walking and all of a sudden it just feels like you lose stability and you feel like you're going to collapse. Most of the time people kind of catch themselves with their other leg or they'll hold on to something. And it's not a good feeling because you can't trust your leg at that point. You can't trust your joint. And if you're trying to walk through a store, walk through your house and you can't trust it, then it's not a fun situation. So it could be arthritis. The weakness is a suggestion that muscles are weak, obviously, but also it could be that your joint is just irritated and it can't tolerate weight bearing. It can't tolerate you being up on them. So my suggestion to you is, if you haven't already, go to the doctor, get an x-ray, see if you can get diagnosed on arthritis if that's the case. That'll give you more clarity. And then you probably need to start working on the muscle imbalance, like we talk about here on this channel all the time, with getting the glutes stronger, the feet, the abs, so that you can put the right pressures through your hip and increase the strength in a way that doesn't aggravate the joint. There's going to be less chance that it's going to be that it's going to want to give way. Hope that helps, Joan. Oh, we have a super chat here. Karen Ann O'Connell, $1.99. Thank you so much, Karen. I appreciate it. No comments on there, just a gift. I appreciate that. My team appreciates it as well. All right, let's get back to the questions over here. Who are we on? Joan. Next is Patches. Oh, my eyes are drying out a little bit. Patches says, have hip and knee arthritis, taking collagen, glucosamine, but no improvement. How to rebuild? Good question, Patches. So collagen, glucosamine, those vitamins and supplements that are for joints, they can help. Potentially, it takes a while. So I would question, how long have you been taking them? And then also, you can't just rely on those, because usually the cause of hip and knee arthritis is a muscle imbalance, and those supplements don't fix muscle imbalances. They just put the right building blocks in place, hopefully, to rebuild tissue in the joint. But if you're squashing your joint because you have a muscle imbalance, no matter how much good building blocks you put in there with glucosamine, chondroitin, MSM, hyaluronic acid, all that stuff, it's still going to negatively impact the joint because you have the muscle imbalance. So in order to rebuild your joints, your hips and knees, you have to go fix that root muscle imbalance that I talk about all the time. You got to get stronger in the glutes. You got to stop activating your quads so much. Like, literally stop using your quads as much as possible. You can't completely stop. It's not possible. Like, you're going to use them to get around and walk around. What I'm asking you is to stop biasing using them. That's possible. You got to go figure that out. I talk about it in my videos all the time. It's in our hip arthritis program, knee arthritis program, which you can start for free. If my team's on there, if you guys can comment on Patches here and let them know the link. But if you just go to our website, epmanualphysicaltherapy.com, Patches, you'll see it right there on the cover. You can start for free. All right, who's next here? Nina. Nina says, can you please demonstrate again how to walk using your glutes? Our glutes. I'm doing your exercise for my torn meniscus. My orthopedic surgeon saw a total knee replacement in my future, but I'm not out to prove him wrong. He make it sound like he's looking at a crystal ball. He's like, I see a knee replacement in your future, Nina. It's gonna happen eventually. No, it's not. We're not getting a knee replacement, Nina. Let's fix your meniscus so that you don't have to have a knee arthritis and a knee replacement later on. Absolutely, I can demonstrate the walking. Let's get a good walking pathway first. How about that walkway right there? All right, so here's how it works, Nina. See me right there? When you take a step with this leg, this is my left leg, I'm going to take a step and put weight on it. As I put weight on that leg, my toes are grabbing a little bit, just gripping the ground. And then as I transfer my weight onto that leg and off my right, now my left glute is activating. Then as I transfer my weight onto my right leg, this glute still, it's pushing me off. And then as I put weight on this side, it's tightening up on this side. So now tightening up over here, tightening up over here. I'm just alternating glute contractions as I bear weight on the leg. And then when you activate your glutes, you should also activate your toes. Toes work with glutes. When the foot lands, your toes should grip the ground a little bit and your glutes should go on one side, just for that moment that you're on the leg, and then stand on the other leg, and then the other glute and the other foot is going to activate. If you can make that a habit, if you can build that into the way that you walk all the time, that sets you up to take pressures off your knee, because then you're not putting pressure through your knee by using your quads too much. Because by default, if you don't use your glutes, your body just figures out how to walk, and it uses whatever muscles like to work a lot, which tends to be the quads, the hip flexors as well. And then if you're not using your toes, then your arch can collapse down, which moves your shin bone inwards, and it just puts bad pressures in your knees. What I mean by that, I'm not going to have a good angle. Let me put it down here. That could work. So if my arches are flat, then my knees are going to want to come in like that. But if I kick in my arches, then my knees come out, and that puts better pressure on through my knee joints, more normal pressure than what it's supposed to take, what it's designed to take. All right, good question, Nina. We got another super chat. Cool. Dom says, you often mention not training quads and training glutes. Yes, but what do you think about seated calf raises and kettlebell toe raises for helping with knee stability in meniscus cases? Good question. I am okay with it. I am okay with seated calf raises. I don't think it's a bad thing. And kettlebell toe raises, I'm not sure about that one. If you mean you're hooking your toes, okay, when you say kettlebell toe raises, I got kettlebells right here. What I'm visualizing is this. Let me put this back down. What I'm visualizing is something like this, where you're picking up your toes with the kettlebell. I don't like that one. I don't think that's a good idea. What I would rather you do is calf raises holding onto a kettlebell. So, doing this bit, you could do it with one leg or two legs. The idea would just be to strengthen your calves. Any way you slice it, if you can strengthen your calves, it's a good thing for knee pain. But I would still focus on glute strength, because that tends to be the bigger problem for most people. If you have a lot of foot problems, then maybe calf strengthening could be a bigger deal. But the reason why I don't like people to do that upward movement with their toes and their foot is because you don't need a lot of strength going in that direction. And healthcare professionals will think in that direction because they're trying to just generally strengthen everything. And so the thought is that if you strengthen your calves by doing seated calf raises or standing calf raises like I was just doing a second ago, then you should also strengthen the muscles on the other side, which are the ones that pick up your ankle and pick up your toes. But like the hand, your hand needs to be strong to crush or to grab things like this, but you don't need a lot of strength to open up your fingers, because how often are you opening up your fingers against resistance? It's rare. You're more so just needing to open up your fingers against your own body so that you can reach and grab the next thing. When it comes to feet and toes, you need to just have enough strength to pick up your toes so that when you walk, you don't trip over them. Watch, I'll show you what I mean. So if I'm walking right here, the comment, I'm going to just get rid of the comment because it gets in the way. So if I'm walking right here, as I swing my leg like right here, if I don't pick up my toes right there, then I'm going to trip and fall. But you have to be able to pick up your toes as you swing your leg through. And so that's all you need strength for. You don't need to pick up a kettlebell when you do that. If you have full range of motion going up in that direction, just like your hands can open up all the way, then you're good. You don't need to exercise it and strengthen it. I think you're actually going to do some bad stuff in your foot if you do that, because that's not the way the foot's designed to work. Hope that helps, Dom. Right, let's go on here. We We had just talked to Nina, talked to Dom. Okay, we have a few comments by Feroza Khan. Feroza says, hi from Spain. Hi, hola. How to monitor after exercise the level of inflammation. Is some inflammation normal or should there be zero? Have chondromalacia patella 4, but no pain, so I am regulating myself with inflammation. Just looking at the next comment here, because then it says, is the absence of pain for chondromalacia level 4 normal? Seems rather like overload that gets worse when pushing it. So when it comes to chondromalacia patella, like with arthritis and like with the meniscus problem, it's possible to have level 4, grade 4 chondromalacia patella, a really bad tear on your meniscus, severe arthritis, as visible on the x-ray or the MRI, but not have any pain. They don't equate. You can, and it's the other way around. You can have very little arthritis or the teeny tiniest meniscus tear, or even no meniscus tear, but meniscus irritation or cartilage irritation before you get chondromalacia patella, and have severe pain. So in other words, your x-ray could look pretty good, but you have severe pain, and your x-ray could look pretty bad, your MRI could look pretty bad, and you have no pain. So don't equate them. Don't think my chondromalacia patella is really bad according to the doctor, but I don't have any pain. That's okay. That's normal. That happens. And the other thing can happen where I have really high pain and it looks like my x-ray is normal. It's because you're about to get something happen. So that's okay. What's likely happening is you have an imbalance. You need to fix it. You need to get stronger glutes, stronger foot muscles to offload the knee joint, and that's going to allow the knee to be healthier. You might always have something visible on your x-ray that looks like chondromalacia patella. You might develop arthritis later on, but painlessly. You don't have any problems and you can do things. That is very possible. Totally possible to feel good despite having problems visible on an x-ray or an MRI. Feroza. Good question. All right, Victoria says, I'm in the maintenance stage of your hip recovery program. Yes! Good job, Victoria. Is it okay to add light hand weights to bridges? Should I try hip thrusts? I'm 66. I don't know how you would do the hand weights to the bridge. I guess if you could put them on your hips as you're doing the bridges, I think that's good. Yeah, that's fine. For a moment, I thought you were doing something with your arms, but that wouldn't make sense. You're adding weight to the bridges, so you're going to make it stronger, harder for your glutes, so that you can make your glutes stronger. Absolutely, 1,000%, that is a good idea. So keep going with that. Hip thrusts with the barbell could work. Of course, the barbell is going to usually weigh about 45 pounds. So you might start with some dumbbells that are lighter than 45 pounds just to test it and see how you feel. Maybe you hang out there for a while before you move on to the barbell, because the barbell is going to be heavy for sure. So good job. Yeah, add some light weights. I think that's good. Ooh, we got a super chat here. Stephen B says, thank you, Stephen B. I appreciate it. Do you think an electro stimulation machine would be helpful for strengthening the glutes and lower abdomen? I've had this question before, and I think it's a cool one. So there's these electrical stimulation machines that have these pads you can put on your muscles, and if you turn it on high enough, it'll make your muscles kind of twitch and move. And they've sold these as like exercise machines that exercise you. You don't have to do the exercise. You can be laying on the couch and get a 6-pack on your abs. And I think it's kind of funny. Theoretically, it's making your muscles twitch and move. It's not natural though. But if you have really, really inactive glutes and ab muscles, I don't think it's a bad idea, actually. I wouldn't use it for a long time, but if you feel like it helps you turn on your glutes and your abs, and then use it just as a boost, so that you can then take over using your abs and your glutes on your own, that could work. That's something that's actually done in rehabilitation after a surgery when people have muscles that have shut down quite a bit. So worth a shot. I just wouldn't rely on it, Stephen. I wouldn't make that your game plan to always work out using that machine. Maybe give it a try for a few days, a week at most. Then you should be able to take over on your own. Good question. Love it. Okay, next question here. We're on Lori. Lori says, will doing your hip exercises strengthen the pelvic floor, or do I have to do specific exercises to strengthen it? Your thoughts on hyper pressures to strengthen it? Good question, Lori. I can't say with certainty that hip exercises like the ones that I recommend will strengthen the pelvic floor. Now, theoretically, they should, because when you do squats, for instance, or bridges, and you're using your glutes, every time you tighten up your glutes and your lower abs, the nerves, they're all wired to work together. Your pelvic floor muscles all closed, all the holes down there will, because nothing should leak, nothing should come out. And so it's possible, though, for you to have another issue that a pelvic floor specialist would need to detect and find and adjust the exercises so that you do the right movement in the pelvic floor muscles while doing squats. And it's not always as simple as a Kegel type motion or Kegel type contraction. And I don't know. I just know that it's more complicated than I know. It takes a specialist. So I would go talk to a pelvic floor specialist, and then you're going to have to piece it together on how to use your pelvic floor muscles while doing exercises. And I hear the stories of moms that have had kids, and then they leak urine when they're doing exercises, and it's a pelvic floor problem. I know there's ways to fix it. It's not something you have to tolerate your whole life, or into your older age, because older ladies will do this too. It's a pelvic floor strength issue, and it's usually something that can be fixed within a treatment plan, within a couple of months, a few months, and you don't have to deal with that. But people live with it for the rest of their life. Go fix that. I'm not the person to help you fix it, though. Sorry, Lori, but excellent question nonetheless. Do you have any super chats? Nope, I got the last one. All right, now we're on Richard McGraw. Hello, Dr. David. Any recommendations for stiff shoulder physical therapy exercises after a humerus fracture that's healing? You got to start moving. First off, get cleared by the doctor that it's okay for you to start moving. Once they give you the okay, because if you're not, it's possible that you're going to exercise it and make it worse and delay healing. So you said that it's healing, which makes me think it's not done healing. So I wouldn't go do anything until the doctor clears you, because even if it doesn't hurt right now, it may not take that much to make it worse. So very much so follow your doctor. When it comes to fractures, broken bones, that's pretty straightforward to heal. And I would trust the doctor on the x-rays. Once they tell you you're healed, x-ray shows the bone is closed, no more fracture, you're good to go on exercise. Once they give you that thumbs up, then you got to go start moving it. Then you got to get like one of those pulley things and start to reach up overhead. You might need to do some rotations in your shoulder, just lying down on your back. I've got videos about this on my YouTube channel. Shrugging exercises are going to be critical to do. Those you might be able to do right now because they don't technically directly put pressure through the arm bone up here, the humerus. So shrugging, I guess, would be the best one. But I would just shrug from down here. Just shrug up and hold it. And then make sure you make a little double chin. Don't let your chin fly out like that, because that way you activate those deep neck muscles to keep your neck safe. Hope that helps, Richard. Whew, we're chugging along here, guys. I got like 5 or 10 more minutes, and I got to go. Jacob says, best exercise for left side neck stenosis. I was just talking about the double chin, that double chin motion. If you have neck stenosis, more often than not, there's 2 things that are wrong, that need to be fixed. Let me say it that way. One is deep neck flexors, which are the muscles. See, here's my throat right here. Where like your airway and your esophagus, where you swallow food and breathe air. Right behind that is the spine, the neck bones. And between the airway and all those important tubes right there and the bones, that's where the deep neck flexor muscles are. So when you tuck your chin down like that, like you're making a double chin, see my big double chin right here? If you make all the double chin you can, you'll feel those muscles behind your throat work. They'll tighten up. And those muscles help to straighten up your spine and your neck and keep it straight. And if you're not doing that, you tend to be like that. Your chin juts out and it puts a fold in your neck back here. And that sets up the holes on the side of the neck to close, which causes stenosis on the sides. And it can cause central stenosis too because it's squashing the discs. So just by tucking the chin in a little bit, that automatically puts you in a better posture. And if this could be your default posture where you come back to, because you might be driving or something and you need to look around on your blind spot, check your mirrors, check around the corners when you're going to turn, but then you come back to this position. That's what you should be doing all the time. So it's a bit of a posture thing. But the second thing is the shrugging muscles. That's what I was working on when I do this overhead press. Every time you come up, you should be, let me just do my reps. You should be shrugging, but keeping your double chin. So pay close attention to how I do this. It's a little heavy. Let's see if I can still accomplish it. I'm gonna do it for just a quick moment. I can't hold it up there for a while and talk. So I give it a little boost in my legs, and then I'm gonna shrug my shoulders all the way. And I'm keeping my double chin. Rather than letting my chin jut out, and then I'm also not just going up to here. See how I have a lot of space between my neck and my shoulders? I need to shrug every time. Close that space. Now, this is weightlifting. You might not be there yet. You can just, without any weights, just like this, reach up and shrug, because people like to only come up to here. You need to go all the way up and get those shrugging muscles working. The better your shrugging muscles get working, the more pressure, the more you normalize the pressures in the neck. All right. Oh, we have another super chat. Logic says, why does my neck go up to the back of my head? Is it because that's how it's attached? I don't know if this is a joke. Thank you for your contribution, Logic. I appreciate it. Why did my neck pain go up to the back of my head? Okay, got it. Sorry, I was reading it wrong. Why does my neck pain go up to the back of my head? That same exercise that I was showing, where you shrug up, the upper trap muscle is the shrugging muscle. So when I reach up and I shrug like that, you see it right there? It goes all the way to the base of my neck. If that muscle gets weak in you, I see this all the time, because this muscle's job, it's got many jobs, but one of its jobs is to hold up your entire shoulder, the weight of your arm, all the way to the hand, against gravity. If it's weak and it can't do that, then this starts to sink down. And I see that with collarbone measurements. I'll take collarbone measurements. People see mine are good. They're angled up. 20, 25 degrees should be the right angle. But when those upper traps get weak, the collarbones sink down. They become more flat. So you might check out your collarbones in the mirror, Logic, and see what you look like. If your collarbones are more straight like this rather than angled upwards, then it starts to tension your neck. And because those upper traps attach all the way up here, it's like somebody's pulling your trap, gravity, and it's just like stretching your neck and shoulder all the time. It's the equivalent of if I took your finger and just held it back like that. Like, you could take that for a little while, but how about 8 hours, 12 hours, all day long? Your finger wouldn't like that. It would start to ache and throb the whole way through, and so that's why your neck is hurting. Get those shrugging muscles stronger, and you'll probably feel a lot better. I hope that helps, Logic. All right, we got time for one more, and a super chat just came in. Tej Singh says, thank you, Tej, I appreciate it. Tej says, I'm 5.5 weeks post-op bucket handle meniscus tear. My range of motion is at 68 degrees. How can I safely get to 90 degrees by next PT 6 weeks? Oh my gosh, you got like what, days to get there? Number one thing I would look to do is loosen the heck out of your quads. A lot of PTs won't massage the quads for you. They don't know to. It's not their fault. It's not taught in schools. It's kind of expert level stuff. but go get a massage gun and just drill that massage gun up and down your thigh. Just literally just zzz, run it up and down your thigh right here. Just stay away from where you had the operation. Just run the massage gun, find the tender spots, and just free that up. And I would be doing that multiple times a day, Tej, because those quads, they get real tight, and then they don't let the knee bend. So if you can free up the quads, then you'll start to get some more motion in the knee. That'd be the first thing I would do. The second thing I would do is, if they're not doing it to you already, I would literally ask the physical therapist, can you do manual therapy on my knee joints? Can you mobilize my knee joints for flexion? If you say those words, they will know what you mean. And if they haven't done it yet, tisk tisk on them. They should be doing it. Even though you're 5.5 weeks out, unless there's some sort of surgeon protocol where they're restricting you from doing that, which I highly doubt, then they don't know how to do the manual therapy on you, which is a very common technique. So they should know, or maybe they're just inexperienced and they're afraid to hurt you or afraid to mess things up. That does happen. But 68 degrees isn't good, man. You should be past 90 by now. So I get it. I get the pressure you're putting yourself under. You might need to get in there and do it yourself. So you're just pushing on the knee joint, trying to get it to bend very carefully, very gradually. But go with the massage gun first, see how much motion you can free up, and then I would directly ask the therapist. And if that therapist can't do it, I would ask the therapist, is there anyone in the office that can? And if everybody says no, you might change clinics and go find yourself a therapist that can somewhere, because time is of the essence here. You have a window for healing and you need to free that up. The worst thing is if you permanently lose some motion. So go get it, Tej. Go fix that knee. Go get 100% of your motion back so that you're not dealing with any long-term problems after this surgery. All right, guys, I got to get going here. It was nice chatting with you all. Thank you all so much for showing up, asking questions. See you next time. Bye.